All right. Welcome everybody to Medicare Portal's Medicare prescription drug conversation. My name is Paul Carswell. I am a licensed Medicare insurance agent here at Medicare Portal, and we're so glad to have you today. As I mentioned, we're going to be diving into Medicare Part D, prescription drugs, and talking about what you need to know. So I will keep my eyes on the chat as well, and as questions come up, either during the conversation or towards the end, we'll get to those. So thank you for your time today, and let's get started. So let's go ahead. There we go. All right, so Medicare Part D and what you need to know, presented by me, Paul Carswell. You can reach out to me there at my contact information. So first of all, Medicare Portal, the question is, who are we? We are a Medicare insurance company based in Tysons Corner, Virginia, and we're here to serve the entire Mid-Atlantic region. I personally am in Charleston, South Carolina. We have agents all up and down the coast, as well as licensed in many other surrounding states. So if you have any questions, or if you're in a state that you wonder if we're licensed in to be able to help you with your insurance policy, just let us know, ask the question. Like I said, we people licensed all over the country. But either way, we are an independent Medicare insurance agency that provides a no-cost education, enrollment, and lifetime support to current and future Medicare beneficiaries. Basically, what that means is if you're on Medicare before you turn 65, or if you're turning 65 and first enrolling in original Medicare, or working past 65 and enrolling in Medicare Part B for the first time at a age past 65 because you're working and had your creditable coverage, we're here to service you at all of those points and then beyond that. So once you already have original Medicare, we'll still be here to provide support. What makes us unique, first of all, is that we're local. Like I said, I'm here in Charleston, so I meet with people in South Carolina face to face, and we have conversations about their Medicare needs. We're based in Virginia. We have agents all in DC, Maryland, Virginia, just really all up in the DMV area, as well as a couple other surrounding states. We're at no cost. A Medicare insurance agent should never bill you for their time. It's not compliant, so we won't ever charge you personally from our own accounts in order to support ourselves. We're a no-cost service to you. We are unbiased. Doesn't matter who we're dealing with. We will talk about Medicare through and through. And then multilingual. We have multiple people in our office that are able to speak multiple different languages, and we're more than ready to help you based on your needs. So what are we going to cover today? Basically, we're going to try and hit these 6 topics right here. First of all, what is Part D, otherwise known as prescription drug coverage? Am I eligible? When do I enroll in a Part D plan? How do I enroll in a Part D plan? How do Part D plans work? And then what does Part D cost? So we'll hopefully be covering all 6 of these things, and we're going to make life a little bit easier to understand in Medicare. All right, so how the new Medicare prescription drug plan works. And this is a little comic for you guys to look at and enjoy. Basically, if you're not confused, then you're not doing it right. There's a lot of moving pieces here. There's a lot of, it's just really, it can be really difficult to understand. So some of the words that we'll talk about co-payments, we'll talk about formularies. There are things affecting like discount cards. We'll talk about tiered co-payments. We will talk about the coverage gap. We'll talk about deductibles. So a lot of these things are relevant to our current conversation. All right. So what is Part D? Prescription drug, Part D is an optional prescription drug coverage benefit program offered by the United States federal government through Medicare. Now, optional is bolded there because you don't need to enroll in a prescription drug plan. However, we will talk about, there are things like late enrollment penalties that do factor in, and we'll touch on those in just a minute. But first of all, they're designed to help save the cost of prescription drugs. And then these plans are offered by private insurance companies. So although it is a government guided or set up plan, it is offered by individual private insurance companies. So you're not going to have your Part D through the government, just like you would have Parts A and B, hospital and medical. Part D would actually be administered through a private insurance company, but recognized by the government as creditable prescription drug coverage. Am I eligible? So anyone who qualifies for Medicare is eligible for a Part D prescription drug plan. And to enroll, you must have any of the following. First of all, you must have Part A only, or you could have Part B only. And then the third option is that you have both Parts A and B. So if you have the red, white, and blue card that says original Medicare on it provided by the government, and your card just has Part A on it, or it says Part A only, you would be eligible. If it just says Part B only, you would be eligible. And then also, if you saw both hospital and medical, Part A and Part B on your red, white, and blue Medicare card, you would be eligible for a prescription drug plan. You must first have one of these three in order to be eligible for a prescription drug plan. So how can I get Part D benefits? You have two options. First is to have a standalone prescription drug plan. And the second option is to have a Medicare Advantage plan, otherwise known as Medicare Part C, and it includes Part D benefits, otherwise known as an MAPD, Medicare Advantage prescription drug plan. So when can I enroll in a Part D plan? You will have three options to enroll in a Part D plan through these three enrollment periods. First is your initial enrollment period. And I realize it says turning 65. It also applies to those who are 64 and under with a qualifying disability. So that would be your initial enrollment period where you could enroll in a prescription drug plan. Second is a special enrollment period, otherwise known as SEP. And this is, for example, if you're working past 65, or if you're moving, or if you have a qualifying condition that creates an eligibility for you to take advantage of a special enrollment period, all of those would apply. And third is the annual enrollment period, which is every year from October 15th to December 7th. And just know that if you allow this to be your first time enrolling in a prescription drug plan versus when you were first eligible for Medicare, you could face a penalty. So what if you don't enroll in a Part D plan? I mentioned this before. You could face a penalty. We just talked about it if you haven't enrolled in a prescription drug plan before you were eligible. So if you're turning 65, you go, no, I don't want a prescription plan. I'll just wait till the enrollment period. There are some things that could factor in, like a late enrollment penalty. So the prescription drug late enrollment penalty is an amount added to the person's monthly Part D premium for failing to enroll on time. On time meaning the timeline with which the government has set for you to need to have recognizable, creditable coverage in the eyes of original Medicare. It's called creditable coverage. Penalty criteria: if you go without a Part D or other creditable prescription drug coverage for any continuous period of 63 days or more after your initial enrollment period, you will have a late enrollment penalty, and it is enforced for your lifetime. So it's a lifetime late enrollment penalty. So you call it LEP late enrollment penalty, LEP lifetime enrollment penalty, whatever you want to call it. You're going to have to pay it if you fall within this category. So here's an example to try and give you some, a situation, a case study for those that would like to see exactly what it would mean. So let's talk about Mr. Steely Dan here. Mr. Steely Dan was without creditable prescription coverage from June of 2019 to December of 2021. So his penalty in 2022 was 31% or 31 months. And the calculation here is that should be 0.31 times 3337, which is the national base beneficiary for 2022. Basically, this number is used, it's averaged out of prescription drug costs, prescription drug premium costs across the United States. And this is used as the standard, basically, to create the late enrollment penalty from year to year. Last year, I think it was just about 10 or 20 cents lower. This year, it's just a little bit higher. It goes up just a few cents each year in order to create this standard. So we've got the 31 months times the 3337. And then you see the multiplication there is 0.01 to create that 1% penalty per month, which gives us a penalty of $10.34 per month. So if we had a prescription plan that costs us $20 a month, and we have this 31, and Mr. Steely Dan has this 31% late enrollment penalty, he will pay that $20 a month, as well as each month this $10.34, making his monthly premium, including his late enrollment penalty, $30.34. Even though his plan costs $20, he now has the monthly late enrollment penalty that he will pay for the rest of his life, and that will be $30.34 instead of the $20 a month plan that he signed up on because of his late enrollment penalty. So that's an example for you. You can chew on it, and we can have a conversation about it later. If you have any questions, throw them in the chat, and I'd be happy to answer them as well. So we're going to move on. How does Medicare Part D work? Let me just stop here and also emphasize that if you ever run into issues understanding what I'm talking about or want to ask more questions, we are available offline. This is just a webinar setting, but we can answer any questions that you may have in a one-on-one setting as well. I'd love to set up an appointment with you or get on the phone. We have so many agents that are ready to help you figure this out. So please ask questions. That's how you learn. That's how we are able to teach and further learn more about your situation, how we can help you out as agents. So please, I encourage you to ask questions, not only in the chat, but afterwards. We have a chat function on our website. You have my personal contact information. You can call me, text me, email me, and I'd be happy to get back to you, as well as all of those other agents that are on our chat function. We'd be happy to service you. So please ask questions. So how does Medicare Part D work? Part D plans are designed that all Part D plans must comply with the standard level of coverage set by original Medicare. Features include the following: formulary, which is a list of drugs that is covered by each prescription plan. They are different from plan to plan, but a lot of plans cover the same drugs, but they offer different tier schedules, which is what I'm getting ready to say here. Drug tiers 1 through 5. Tier 1 is going to be the least expensive. Tier 5 is going to be the most expensive. Or actually, I should go tier 1 should be the least expensive. Tier 5 is going to be the most expensive, going from preferred generic to preferred brand name to non-preferred brand name, and then specialty drug is going to be your highest cost. The coverage stages, there are 4 of them, and your true out-of-pocket, total annual out-of-pocket. Then you have other things to talk about, like prior authorization, quantity limits, and step therapy. And we can talk more specifically about those if you have additional questions. I'd be happy to go through those. Or if you have a drug where you are requiring a prior authorization, that's something we can navigate with the doctor and the insurance company. There are prior authorizations forms to fill out at your primary care doctor or your specialist in order to get these things processed. All right, formulary. It's also called a drug list, and it's a list of prescription drugs covered by a Part D prescription drug plan. So they will vary by company. One company is going to have a handful of drugs on their formulary, and another one would have the same amount of drugs. But like I mentioned, they could be on different tiers. Like here, it says including generic and brand name drugs. Again, you could be taking a generic drug, but the drug formulary could recognize it as a tier 3 preferred brand name drug, when another company refers to it as tier 2 standard generic or non-preferred generic. So it just changes by plan. That's why you work with an agent, so we can look at these costs for you and help you identify what your best fit is. So they must provide at least 2 medications per drug category. So if you have a certain condition, there must be a covered drug for that condition on each of these formularies. Drug tiers. So used to distinguish the cost between formulary drugs. As I mentioned, you've got the lowest cost is your preferred generics, and the highest cost is your specialty drugs. So lowest cost tier 1, preferred generics. Tier 2, it's medium co-payment. It's going to be a little higher than tier 1. They're considered just generic, standard generics. Tier 3, a little bit of a higher co-payment. This tier is called preferred brand name drugs. Tier 4 is non-preferred drugs, and they're higher than tier 3. And then tier 5 is specialty drugs. This is going to be your highest copayment. Usually falls under about 25% coinsurance, but these drugs are really expensive, usually in the 4 digits. But either way, they're going to be your highest drugs. What you do is you work with an agent. We go through these tiers based on the drug list that you've submitted to us, and we put together quotes that include costs, pharmacies, prescription drug plans, and help you navigate all of these costs, what's going to cost you for the year, and we look through that as your agent. The 4 stages of Part D plans fall into the following: deductible, initial coverage, coverage gap, and coverage gap or the donut hole, and then catastrophic coverage. So stage 1 in the deductible is you pay all the costs. The maximum deductible for 2022 is $480. So these are the costs that you would pay into this before you start receiving your $10 copayment. So most plans have tiers 1 and 2 generics exempt from the deductible. There are some plans that include tiers 1 and 2 in the deductible, but usually it will be tiers 3, 4, and 5 that will apply to the deductible, while tiers 1 and 2 are exempt from you having to pay your deductible. So yeah, well, it's right here. So some plans have 0 deductible. Tiers 1 and 2 are often exempt, typically applied to tiers 3, 4, and 5. What that means is if you have tier 1 and 2 have a copayment of $0 and $5, while tier 3 has a $20 copayment. The tier 3 drug you're taking costs $35. You pay the full $35 for that cost of drug until you reach $480 out of pocket for the year. And then once you've reached that $480, you will now pay the negotiated $20 copayment amount, and which is set within your tier 3 plan drug coverage. So again, we can talk about specifics. If you have questions, I'd be happy to go through that with you. Tier 2 is called the initial coverage. Basically, it's where the covered prescriptions require a copay or a coinsurance, and this stage continues until the total drug cost reaches $44.30, and this is in the year of 2022. So your total cost of drugs would reach $44.30. So your total cost of drugs include the amount both you and your plan have paid for your covered drugs in the plan year, and this excludes the premiums paid. For example, I mentioned the drug earlier that was $35 of cost, even though the copayment was $20. That $35 of cost, even though you would finally get to the copayment amount of $20, the other $15 is still being paid by your company. And so that $35 is total drug cost. So we're looking at total drug cost to reach $44.30 for each year. And that's what would kick you out of the initial coverage and push you into the coverage gap. So you enter this stage after spending $44.30 in total drug costs. And I'm sorry, I realize I'm going quickly, but this is just a lot of information and to get through it. And if you have additional questions, please put them in the chat, or you can contact me, like I said, on my information that I sent you earlier. And I'll have that again at the end of the presentation. So you enter this stage after spending, back to coverage gap. You enter this stage after spending $44.30 in total drug costs. The drug manufacturer pays 70%, your plan pays 5%, and you pay 25% of drug costs or 25% of the dispensing fees after that. You'll remain in this stage until the total out-of-pocket reaches 70/50 for the year. So note that premiums also do not count towards this out-of-pocket. So this is 70/50 for the course of the year of what you've paid out of your own pocket. That's what causes you to escape the coverage gap or the donut hole, where you're paying 25% for your drug costs. For higher utilizers, some plans provide additional coverage while in the coverage gap as well. So if you have an extensive drug list, that's something to look into. And again, that's something that your agent could find really easily when it comes to getting the costs and keeping your costs low. Last thing you enter is a catastrophic drug phase. This is the final phase after you've reached your total out of pocket for the year to 70/50 here in 2022. At this point, you pay a small copay or coinsurance for the remaining plan year, which ends on December 31st of 2022, where you pay either 5% of drug costs or a copay that's set at, I can't remember the dollar amount. I think it's like $3.40 for generics and like $8.90, something like that, for your drugs. Whichever one is higher, whether it's 5% of the cost of the drug or if the copay that's set for the year of 2022 is higher, then you would pay whichever one is higher. And the plan benefits restart on January 1st of the following year. So again, December 31st rolls around and you're only paying this 5% of drug costs with a set copayment. January 1st hits, you're right back to zero. So your total out of pocket for the year is going to be zero. It is an annual cycle and it resets on January 1st. So important tips to know: step therapy. Step therapy is a process in which, I don't think we're going to talk about that yet. Let me back up. Step therapy is a process in which you would do your best. The company and your physician would do their best to get you from taking the brand name drug. So they do step therapy like tier 1. They would check the drug that serves your needs on tier 1 or tier 2. Basically trying the generic version of whatever drug is costly for both you and the company. And if that does not work for some reason, then they continue upward to the brand name drug, and then from there to any other drug options that are available. So that's called step therapy. Next is prior authorization. Some drugs require prior authorization. Usually like pain medication requires a prior authorization where your physician would need to basically send a doctor's note up to the insurance company verifying that, yes, in fact, this is a prescription that needs to be filled for this patient for this amount of time. There's a prior authorization form that the physician should have in order to get that prescription cleared. And then last is a quantity limit. For example, like with those pain medications, a lot of times the initial fill is only for 7 days, or it could be another prescription that only has a 30-day limit. And that would be the initial fill is only allowed to be filled for 30 days. And you would have to go and get another prescription written after that. Things like that would factor into quantity limits. So again, if you have a drug that falls on that, we can talk about it and see if there's any ways that we can communicate with our physician in order to get that quantity limit or prior authorization filled. The next thing we want to talk about is IRMA. IRMA stands for Income Related Monthly Adjustment Amount. So Income Related Monthly Adjustment Amount, and these are the numbers for 2022. These basically factor into your modified adjusted gross income from 2 years prior. So in this case, we're now looking at the MAGI of 2020 to verify whether you're going to be paying what your plan has set. So again, we used $20 as a plan premium before. This is a situation where if you made a certain dollar amount and reported MAGI of anywhere in some of these thresholds, then you would have an increase of your premium potentially. So it's just good to know that these numbers exist. And just like, for example, we'll just look at the first category, but if you fall into any of these, again, we can have a conversation about it and talk about how it impacts you and or your spouse. So for example, the first tier where there would be a bump, if you make 91,000 or less or 82,000 or less as a joint filed couple filing jointly, your plan premium would be just what's negotiated on Plan Finder or anything like that, where we look at if it's $20, your plan premium is going to be $20. But if you made between 90,000 and 114,000 as an individual, or anywhere between 182 and 228 as a couple or filing jointly, then you would have an increased amount for this plan year, only for this plan year. The MAGI would be reflected in 2023. The MAGI in 2021 would reflect your IRMA increase in 2023. So right now we're in 2020 looking back. We're in 2022 looking back to our 2020 MAGI. Next year, we would be looking at our 2021 MAGI for our 2023 increase if it applied. So you might ask, I have this increase of 5170. This is ridiculous. Just so you know, it might just be a one-year thing depending on your income. It could change from year to year based on the amount of MAGI that you claim from year to year. So just know that it could change. And yeah. How to pick a Part D plan. First of all, you got to look at your coverage, review your formulary and their tiers. Someone like myself would take your drug list. I'd look at what tiers these things fall under within each plan, and I'd help you make a decision based on that, because the next thing is cost. these tiers are going to impact your costs, as well as the pharmacy, as well as the plan you pick. There's so many different variables as to what would go into the costs that you might have to pay. Is there a deductible that you would have to cover? Would a zero deductible plan, although potentially having a higher premium, cover your drugs and keep your costs down for the year lower? Yeah, there's a chance. So it's just worth looking at. And then also check your eligibility for LIS. If you feel like you qualify for what's called extra help through original Medicare, you could get your prescription costs knocked down, as well as plan premium potentially. So if you're qualified for LIS, then take a look into that through the extra help. Next is identifying plans with your preferred pharmacy. So again, if you have a pharmacy that you currently visit and you're definitely wanting to stay with them, we want to look and see if there's any plans that consider that pharmacy preferred. So that way we can keep your costs down, because going to a preferred in-network pharmacy versus a standard in-network pharmacy will change the cost, as well as if you were to go to an out-of-network pharmacy for the plan that you've selected, that could really drive cost up. So we want to make sure that you're on a preferred in-network pharmacy, and if not, at least that it's standard and the costs are relative based on your preference, if you want to stay with that pharmacy or go elsewhere. And then last is the quality, comparing performance and satisfaction by reviewing their star ratings. Generally, if a plan has 4 stars or 5 stars, it's going to be a better quality plan when it comes to just its all-around usage, as opposed to a plan that's got 2 stars or 1.5 stars. But really, it comes down to preference and some of the things that you prefer. I find as an agent that sometimes mail order can be more difficult on lower. This is just what I've found through case studies, is that if you would like to use mail order, then we just factor in what the client experience can be like with each company. But it's a conversation that we have, and we figure out what works for you. How can Medicare Portal help? So review existing benefits and new options during AEP. Another thing that we can do is confirm participation with your preferred pharmacy or the pharmacies that could be preferred on the plans that we're seeking. Ensuring that your plan meets your medical and financial needs, and then assisting in enrollment and ongoing customer support. As I mentioned earlier on, or a lifetime support for you and your colleagues or friends that are also turning 65 or past 65, enrolled on Medicare. Final thoughts, start early, please. The annual enrollment period is October 15th to December 7th. If I'm getting a phone call on December 6th and it's the first one we've had, I'm gonna be pretty upset personally, but I would still help you. We can start this conversation as soon as September 1st. We can start it even August to get our ducks in a row. So that way, when October 15th comes, we can make the necessary moves and be proactive rather than reactive. Do your research as well. I'm going to help you as much as I can, but at the end of the day, it is your choice. I'm going to provide options and reasonable resources and options to you. But I'm going to help you make the best decision you possibly can. But again, it is still your decision to make. It is your health insurance. It's your your personal coverage. I'm just doing my best to guide you there. Understanding your options. So just knowing all what's available to you, using the plan finder yourself, if you want to, go into that, and then just realizing what your prescription needs are and your preferences. And then finally, ask questions and seek assistance if needed. I can't stress this enough. Just reach out, and we are an at no cost service. Use our help. We're here to assist you. We're here to help you make the best decision. And even if that means staying with the current plan that you're on, we're not going to just enroll you just to take you on as a new client. We're going to help you see what is the best fit for you and your family. Finally, if there is any questions, this would be a great time. I would be happy to answer them. I'm going to put on my contact information here on the end and hang out for a couple more minutes and allow for questions to be asked. So if there's any questions, please shoot them in the chat. And if you don't have any questions, then thank you for joining us today. I'm going to hang in for another minute or so in case there's any questions, and just smile at the screen. All right. So we have a couple questions here. The first question says, what happens if you enroll in Part D to avoid the penalty, but don't need prescriptions? Can you cancel the policy without having to pay the penalty? So you should have a Part D plan. Again, I mentioned it was optional, but you should have a Part D plan even if you don't have any prescriptions. I've run into a couple different situations where individuals were turning 65 and they were perfectly healthy in their own mind, and they opted to not take a prescription drug plan, just like the example we talked about with Steely Dan. I'm actually going to shoot back up to that so we can take a look at it. So let's just say that Mr. Steely Dan was totally healthy when he was first eligible in June of 2019. And then at the end of 2021, we're just putting some facts with this, or some suggestions with this, to try and help create the personal feel and what you could potentially come across. He was first eligible in June of 19, but didn't decide to take a coverage until 2022 came around. That's where you get this 31 months. He is going to have a late enrollment penalty because there is no reason that he didn't have what's called creditable prescription drug coverage in the eyes of Medicare from when he was first eligible. Even if he did not need prescription drug coverage, he will be penalized for not taking any kind of prescription drug coverage. So can you cancel the policy? The second part of that question was, can you cancel the policy without having to pay the penalty? If you don't have let's put it this way. If you don't have creditable coverage from the time you were first eligible for original Medicare, you will have to pay this penalty. So when you are first eligible, you will either have to have a creditable prescription drug coverage in place or enroll in a prescription drug plan through Medicare, through Medicare prescription drug program, or else you will have a late enrollment penalty to pay for. So the creditable prescription drug could look like employer coverage. It could be a federal plan. It could be, there are other options to have creditable coverage, but if you don't have any of those available to you, then you will need a prescription drug plan through Medicare Part D. So that's a good question. Got one more question here. When should I call you when I'm ready? When should I call you when I'm ready to enroll in Medicare for the first time? So ideally, if you're turning 65, calling anytime at around 3 months before you turn 65. I'd argue even 6 months to have an initial conversation, so that when we get to the 3-month time period, we can have a more specific, tailored conversation. We're already familiar with each other and our direction and preferences. So when turning 65, you have 3 months before you turn 65, the month of your 65th birthday, and then 3 months after your 65th birthday, that's your initial enrollment period, as I mentioned here. Here we go. Your initial enrollment period is, so if Mr. Steely Dan turned 65 in the month of June, and so his initial enrollment period would have been March, April, May, the 3 months before, June, the month of his 65th birthday, and then July, August, September, the 3 months after his 65th birthday, in order to enroll in original Medicare, Parts A and B, as well as a prescription drug coverage or Medicare Advantage plan, if he so wanted. And so another time that you could talk with me about, or an agent about, enrolling in a prescription drug plan is in the case of a special enrollment period, like if someone's working past 65 or moving. If you know you're going to be retiring and losing your employer coverage that was covering you beforehand, or if you know you are going to be moving and it's going to cancel your policy on X date, then contact me at least a month in advance. I mean, really pushing it, you could contact me the couple days before or the day before, and we could put a policy in place. But really, I think the most important thing to keep in mind is the sooner the better. I'm going to try to find the screen for it right here. So one of the things focused on here in the late enrollment penalty, you cannot go a continuous period of 63 days or more after your IEP, or even after some SEPs, special enrollment periods. Otherwise, you'd be considered, it would fall under a late enrollment penalty. So the sooner the better. If you can anticipate it, great, then let's get moving sooner rather than later. If you're absolutely up to the last day, then let's get it done. But just know that if you go 63 days or more after without having creditable coverage, then you will be charged a late enrollment penalty for those months that you were not covered. It's a good question. So how do you know, this last question, I think, or if there's any others, just keep them coming in as I'm talking. How do I know how much my prescriptions are going to cost? So there's a couple different variables here. The few things that we look at that end up factoring into what your drugs cost. The first, or well, really all three of these are, 3 or 4 of these, which however many I'm going to come up with, are relevant. Pharmacy factors in, whether you're using a preferred, standard, or out-of-network pharmacy. The prescription plan that you select is going to factor in, and then the prescription list, your formulary, your personal formulary is going to factor in. So if you send me a list of drugs that is 4 drugs long, I look at each of those drugs and where they fall on each prescription plan's formulary tiered structure. So you send me your drug list, and I look at each plan's formulary and where they fall on their tier structures. Is tier 1? Is this tier 2? Is this tier 3 or tier 4? Or even tier 5? And then from there, I would also check the pharmacies that are nearby. If you have one pharmacy specifically that you would like to go to, and it's non-negotiable, then I would look at plans that work with that pharmacy and what the cost would be. I'd probably also look for those and offer a supporting view if there's nearby pharmacies that you could go to, make your drug costs a little bit more affordable. So the things I factor in, there are 3 things. I narrowed them down. I just had to make sure in my head: pharmacy, the prescription plan that you're using, and the drug lists that you come to me with. All of those are going to factor in and change the drug costs depending on where you're going, what plan you're on, and what drugs you're taking. So again, as you see, that turns really into more of an individual conversation. I'm going to go back and put my contact information here. So if you have any questions, it's my phone number, it's my cell, got it right here. Call me, shoot me a text message. That's my email, and that is our website. So if you have any other questions and you would like to chat with we have a chat function on our website that's functional as well. But everyone knows that talking with a person and knowing you're getting a person right away, that's what you're getting with me. So give me a call, shoot me an email. We actually do have a person manning our chat function, but just personally saying, if you want to reach out to me, I'd be happy to help and guide you in the right direction. So one of our taglines here at Medicare Portal, thank you for those questions. I'm going to get ready to send you off. And here at Medicare Portal, no more, stress less. Thanks.